So this is Coco, 2 weeks old, eating hay, grazing. She's been doing that for a while, chewing her cud, believe it or not. Straightforward birth, easy breezy, lots of milk. Very energetic, as you can see. Very healthy. She's going to go see her little sisters who are over here. This one here, who's running away, is Prima Donna. And we actually posted a video of her birth. It was a mild dystocia. Mom, we're not sure how long Mom had been in labor, but she was pretty exhausted, so was having a tough time getting her out. And baby came out pretty energetic. Well, not too energetic, but she was fine. Nursed pretty quickly. Could tell she got colostrum. But for the next 2 days, she was kind of lethargic, not what we like to see, not up and playing or running or exploring. Her mom, it's a first-time mom, and was also pretty protective, wouldn't let her out of her sight, wouldn't let her go. The mom wouldn't even go to the bathroom because she would have to leave her baby, so she was pretty protective. But baby just wasn't quite right, was losing weight, which is normal for the first couple of days, but she was really losing weight, and her energy was not, she just didn't have a lot of energy. So we were watching Mom's milk, and we know she got colostrum, but Mom's milk hadn't really come in yet. And baby would kind of nurse without a lot of energy, and Mom would walk away, and Mom didn't really like nursing while we were around, so we kind of just left them and kept a distant eye. By day 3, baby was just really lying around, so I decided to supplement her, to give her a bottle of goat's milk, because Mom's milk hadn't come in yet. And so that night I gave her a bottle of goat's milk, and you could just hear she was empty. And she just sucked down 6 ounces of goat's milk. And then I milked Mom out, and Mom, only 1 teat had milk at that point. So I got 2 ounces, and baby sucked that down. And within 5 minutes, that baby's energy just was completely different. And she went over and started trying to nurse, and by the next day she'd actually gained 6 ounces, which of course I had given her milk, but she had probably peed through the night. So and her energy was great. So I wasn't worried about her anymore, and Mom's milk obviously had come in. All 4 teats were engorged, and baby was nursing, and she recovered almost immediately. But we kept a distant eye to make sure that she was doing okay, and we didn't want her to get so depleted that she was hypoglycemic, and but we also didn't want to interfere too early and break that bond, because Mom is a nervous first-time mom, or intervene too much so that the baby wanted a bottle instead of Mom, and Mom's milk production wasn't sustainable because there was nobody nursing. So anyway, she's now the leader of the pack, zooming around usually, except for right now, where she's going to curtsy and take a bow. And then over here we have Bella Donna, who is a day old, actually not even a day old yet, and her mom presented yesterday morning with a vaginal prolapse, which she's never had before. Our ranch helper thought she was in labor, and it was her due date yesterday, so we thought so too, but when I came out and saw this big red balloon hanging out of her, I knew that's what that was. But she wasn't in labor, so we just kept an eye on her, and she was quite content chewing her cud like she is now. So we just kept watching her on and off throughout the day. Sometimes she'd look a little uncomfortable, but get up and go eat or chew her cud, so we just left her alone. The prolapse would come out every now and then and go back in. Nothing too concerning, but we kept an eye on it. And then, so once I was sure everything was A-okay, nothing was going to happen, I went and took a nap, which is a surefire way to have your prolapsing alpaca go into labor. Came out at, I guess it was probably about 3:30, just to check on everybody. And from the distance saw a glistening placenta in the pasture, and then started looking around. I knew it would be a black baby because that's just my luck. But we found this beautiful little lavender kiddo with membranes, dried fleece, cushed. And when I approached her, she jumped up and zoomed across the pasture and started nursing. And, you know, something that appeared that it might not be textbook turned out to be a totally textbook delivery. And, you know, in all these cases, I guess, from textbook, everything's perfect, not even a slight hiccup in the road, to a vaginal prolapse, to a mild dystocia. It's interesting when to choose to get involved and when to just kind of sit back and let nature take its course, because if we get involved, we can really kind of ruin the bonds that are there. And anyway, she's active, was zooming around the pasture today. She just got a nice nursing, so she's got a full belly, and she's waiting to have her pedicure done. So, as you can see, she's very patient, too. So anyway, that's the story of our last couple weeks here at Renaissance Ridge.